Hi, my name is Professor Tony Ryan. I'm a consultant neonatologist at Cork University Maternity Hospital, and I got involved in a partnership with Dr. Sami Ahmed, who's a paediatrician in the Bonds in Cork. We started going to Khartoum together, teaching the neonatal resuscitation program, and then after a number of years, we began a formal link with the maternity hospital there called Omdurman Maternity Hospital. And at the same time, we were bringing 3 maternity hospitals together in Cork to form a new maternity hospital. We took a number of approaches to make our partnership. First was that we knew there would be equipment coming from the 3 hospitals. In fact, we filled up 5 containers, 40-foot containers of equipment early in 2003, 4 and 5, which we sent out to Omdurman. Secondly, we made about 9 multidisciplinary visits to Omdurman. Paediatricians, obstetricians, midwives, paramedics, and the main purpose of those were short visits of education, bilateral learning, friendship, and cultural understanding. We also brought some of the doctors over and midwives over to Ireland and Cork, and we developed a lot of friendships as well. We had a formal agreement drawn up between us. We got the money from Irish Aid, and we helped them to stock up a new lab that was built by the government on the site. At the same time, in the early part of the decade, Dr. Morwan and Dr. Elzin, 2 obstetricians, came back to Sudan, and they came back to try to build up Omdurman Maternity Hospital. They brought back a number of anaesthetists and obstetricians and paediatricians, and they made some very simple changes. They were the knowledge makers in a way. They had the evidence. They knew how they could save women's lives. When they came back that year, 47 women died in the year 2000. And by simple evidence-based practices, by the year 2007, they had reduced that down to 8 women dying. And the number of deliveries had gone up significantly, up to 15,000 in 2007. The number of stillbirths dropped dramatically as well. And also, they continued to drop. The other things that they did included regular rounds, communication, handovers, education. They were all very simple projects. We taught newborn resuscitation to the midwives. I think we brought friendship, moral support, and guidance. While we were there, actually, I found a logbook that goes back to about 1957. And it was filled in by the nurses, the nuns who founded that hospital. It was founded originally by Italian nuns, and they had a little chapel there. And from that, we were able to get the data of obstetrical outcomes of over 50 years. And with the help of Dr. Morwan and his group, we published that data as well, and showed the huge quality improvement initiative from the beginning of the 2000s decade up towards the end. And recently, we showed how this improvement had continued, because between 2007 and 2012 the deliveries rate doubled again, 36,000 deliveries last year, and they managed to maintain the same quality in terms of outcome. And neonatal outcome also improved over the last number of years. So I suppose what lessons did we learn? I think number one, we never expected this to happen when we went into this partnership. We kind of fell into it in many ways. Number two, we were very lucky to get a grant from Irish Aid. The little bit of money, the money that we did get was put to very, very good use, and I think it was so important in allowing us to travel, number one, which was only a small part of the budget. The main part was being able to give them vital equipment in the laboratories that allowed them to set up their laboratories and the neonatal unit. I think that having Dr. Sami and another obstetrician there as connectors are really important. Somebody to understand the cultural differences and to deal out with all of the smooth out the issue culturally, and to deal with language and help us to understand and get to know the Sudanese people who are very fine people, very hospitable and very grateful, because they had been isolated for many, many years and still are very isolated politically and academically as well. So we became their friends, and I think that the Irish Aid understanding is that they give aid based on the people's needs, not on political understanding, but on what the people need, and I think that they were very grateful for that. I think the other thing is that Margaret Mead said, change comes when you have a small group of committed people, and this was true of the Omdurman project. I mean, the number of people contributing to it was quite a small number, and they were motivated. The Sudanese staff measured less than 20, I would say, in terms of anaesthetists, obstetricians, and their midwives were just a joy to be around. I mean, they were fantastic women to train, and they wanted to learn. We taught them newborn resuscitation. Our midwives mingled with them, and they were really anxious to learn. So a small group of people can make a huge difference. I think that's really important to know. And then I think that most Sudanese doctors want to go back to Sudan, but when they go back, many of them can't stay because they can't afford to bring up their families, and they end up going to the Middle East or leaving back to the UK and Ireland. But Dr. Morwan managed to keep his staff there, and the reason he did was with government support he was able to open up a private wing in the hospital, and with that private wing he not only kept the obstetricians and anaesthetists there, but he was able to put funds back into the public hospital, and anyone who arrives in the hospital gates will be seen. Nobody is turned away. There's a small fee for people who can afford to pay, but the private wing has a big, important role to play in keeping the public hospital, this huge public hospital, functioning the way it does. I think finally, the thing that really is underestimated and forgotten sometimes, I think, is leadership. And I've met Morwan and Elzin, the former medical CEO, and they're both quiet men, but and I've seen Morwan over the last 10 years, and I've seen him slowly adding on to new projects in the hospital. And he was there with us at the beginning, loading up equipment down at St. Finbar's Hospital onto the containers. A modest man, and yet he got things done. He does things quietly, he motivates people quietly. I think he's managed to keep his staff, and I think whatever it is about his style of leadership, I think that was very important as well. And the fact that he stayed with them, solidarity with his people, solidarity with the doctors, and solidarity with the nursing staff. I think it's really important. And as long as they can show that they're willing to sit out, because it's hard, because I think that every day there's 130 babies born in that hospital, but there's a number of babies will die every day. Every single day there will be deaths among the babies, and that's hard. And it's really hard work on the doctors and the nurses as well. The turnover is so great. Of those 130 babies, there's going to be about 30 sections, cesarean sections every day. Sometimes even up to 40 cesarean sections a day. So it's a huge turnover, a huge amount of work, very high acuity, and I don't know some ways how they do it. I think that one of the doctors, when they came out there, one of the obstetricians just looked at them in amazement, and I think, as we all do, and seeing the amount of work going out there. And when he came back, he just said 2 words, he said, or 3, he said, humbled, not proud. You know, I think he's just humbled by the what people do out there, by the work that they manage to do with the resources. And I think that's what we learned from them. You know, you learn that people have to do so much with so little. People have to live with so much loss and grief as well, and get on with it. And they do get on with their lives. And also, people are very appreciative of small things. You know, so I think this partnership has been good for a lot of people in Ireland. We've moved into a community project now, but I would still like that maybe we could reenact more and another aspect of this hospital project again. So that would be my goal, I think, is to see, can we open it up in a different area, maybe get new people to go out and experience what we have out there. Thank you.